Hello, everybody. My name is Ngozi Ebo. I'm a family nurse practitioner. And my topic today is going to be on diabetes. Reason being that diabetes is growing in an epidemic rate here in the United States. In the last 20 years, the amount of people diagnosed with diabetes has more than doubled. According to American Diabetes Association and Center for Disease Control and Prevention, 38 million people of different ages are diagnosed with diabetes each year. Diabetes is the number 8 leading cause of death and number 1 leading cause of kidney failure, lower limb amputation, and adult blindness. 98 million people out there are pre-diabetic, and 8 in 10 of those people are not even aware that they are pre-diabetic. Diabetes is a chronic, which means is a long-lasting health condition that affects how your body converts food into energy. So the body breaks down most food and convert it into glucose. It's then transported into the bloodstream. When the blood level of glucose increases, it sends signals to the beta cell of the pancreas to release insulin. Insulin now is the key to transport those blood glucose into the body cell to be used as energy. So when we talk about diabetes, it means that the body is not able to produce insulin, or the body is now resistant to the insulin production and is not using it as well as it should. Increase rate of the blood glucose in the bloodstream in a long run will lead to health complications such as heart disease, kidney failure, lower limb amputation, adult blindness, only to name a few. There are three official types of diabetes. We have the type 1 diabetes, which is known as the insulin dependent, and is also known as juvenile diabetes, which means most of the time it's diagnosed at a young age. So, this type of diabetes is due to autoimmune dysfunction, which means the body is mistakenly breaking down those beta cells in the pancreas that release insulin. So, there's little or no insulin production. So, patients with type 1 diabetes undergo what we call insulin replacement therapy, which means they have to inject themselves with insulin each day. And the type 1 diabetes represent about 5 to 10% of those that have diabetes. Then the second one is the type 2 diabetes. This type of diabetes can be prevented, it can be delayed, and it can be reversed. So type 2 diabetes is called insulin resistant diabetes. So there's production of insulin, but the body is resistant to it and is not being able to use it the way that it should. This type of diabetes affects about 90 to 95% of those that have diabetes. And the treatment plan is diet modification, exercise, and medication. And the third one is called gestational diabetes. This occurs during pregnancy and in most cases resolves after childbirth. However, the mother and child is at increased risk of developing diabetes later in life. So, as of right now, there's no cure for diabetes, but depending on the type of diabetes, we have treatment plans to help. It's good to know your numbers. For a person to be diagnosed with pre-diabetic, the hemoglobin A1C has to be between 5.7 to 6.4%. Anything above 6.5, the person becomes diabetic. So please know your numbers, ask questions on how you can better take care of yourself, because health is wealth. If you like this video, give me a thumbs up, subscribe to this video so that each time I upload a video, you will be notified. And please share this video to your friends and family, because knowledge is power.